to move to the next session if in case no one has any question. Yeah, I can see on chat we did not get any question for this presentation, and just sharing again, we'll be having two other lightning talks happening at the same time. So if you're interested in attending the next session on the Global Healthsites Mapping Project, where they'll be sharing how the mapping project in mapping emergency health services in Senegal by Mark Herringer. Kindly remain on this room, but if you're interested in attending the other presentation on volunteer activation and creating documentation in Turkey, I'll be sharing another link as well on chat to join that specific session. So if the tech team could bring up slides for Mark, and then Mark, you can go ahead and start.
Hi everyone, can you hear me okay?
Yes, you can hear you.
Fantastic. Thank you very much. Welcome everybody, and it's great to be chatting at the Hot Summit 2020. I'm going to be showing you a method today that we've developed to essentially identify emergency health attributes and how to use this method to guide the work that we're doing to map emergency health data in OpenStreetMap. So, okay, essentially we have been given guidance by the Kemri Wellcome Trust, which many of you in Kenya will be familiar with. They've been doing amazing work with health facility data in Africa for in the region of 2 to 3 decades. And they put together a database of health facilities throughout Africa, from PDF documents, people's hard drives, CSV files, wherever they could get the most reliable data, regardless of the data license. They put it together in a database, and these 80,000 points are what you can see, those red dots throughout Africa. And out of those 80,000, there were 4,908 public hospitals where they could not tell you which services were available in these hospitals, in these public health facilities. And as a result of that, they concluded in the Lancet Global Health that the definition of these emergency health services should be a priority. And this is the lead that we've taken from the Kemri Wellcome Trust. And we see OpenStreetMap and the Missing Maps movement in particular as being ideally suited to help maintain or establish and maintain this data. And that's what we're doing with the Healthsites mapping project. And I'm going to show you a method that, as I mentioned earlier, that we're using to define user stories and in so doing, identify the most appropriate attributes to map. Okay, so just to take a step back, Healthsites has a couple of four key activities that we're focused in on. And we support stakeholders in the health cluster to get their data into OpenStreetMap. So if you are working in a particular area and you have intimate knowledge of the capacity of health facilities, you can get that data into OpenStreetMap and we can support you with that. Establishing volunteer communities around national health agencies is another area that we focused in on. Lamine and Diai and the OpenStreetMap Senegal team have been working closely with us over the last couple of years, as well as the Humanitarian Data Exchange, to support this need and provide this capacity. Thirdly, building high quality data. We are an open development platform, open source platform where we're showing the quality of the data that we're publishing and looking to improve that. And finally, and the focus of this presentation, we are driving the development of the data through human-centered design. And so that's what we're going to get onto. Okay, so Our strategy then, open standards with OpenStreetMap, an open source GitHub platform, and then human-centered design to understand what people want on the ground so that we are improving the data which is relevant to people on the ground. And we want to essentially attack Sustainable Development Goal 3.8 continually and iteratively and try and get the voice of the people to reach us. And I hope that this method I'm going to show you will do that. So when I'm talking about baseline health facility data, this is what I mean. We are basically using a specification given to us by the International Hospital Federation. When we launched with the ICRC back in 2016, the International Hospital Federation joined us and said, look, these are attributes that should be in the public domain. Everyone should know this information and it should be accurate and up to date. And so the type of facility, the address, the specialities within that facility, the staff complement, and other important attributes like the electricity and water source and whether or not it's an emergency facility or not. So this is the baseline. Okay, so when you actually come to updating the information on Healthsites, this is what it looks like. We present the OpenStreetMap attributes that support this specification given to us by the International Hospital Federation so long ago, and it is tremendously varied and detailed. As you can see, we can specify X-rays and ultrasounds and specialities that are available. Okay, and then to coming to the important question, so which of these attributes, how do we know which ones to focus on first? Okay, so if any of you have ever developed software, or if you haven't developed software, let's say, this image is going to look quite strange. But essentially, it's a technique known as, I know it as the Kawakita technique by, I believe it's a Japanese designer that established this method. And what we do is that we invite people to stand in a room and write down user stories on Post-it notes, which are important to them. And we take a cross-functional group. We want men, women, and children to write down what is important to them with regards to health. And then there is a very specific method which you can find out about, and I can share that information with you. But we then start grouping the tickets according to functionality or which tickets seem the same. And then once they've been grouped, we give those groups a name. And then each participant in the room who's been participating in this workshop gets to vote. They get these red stickers, and they each have 3 red stickers which they can place on the groups that they think are the most important. And so, you may find that after completing this exercise, maternity healthcare has received the most stickers. And then from a software perspective, or just from a perspective of trying to understand what the vote of the group is, we're able to see, right, maternity healthcare is what is most important, and this is what we should focus in on. So essentially, this is just the method that we use to work out what to focus on first. Okay, so here's the sentence structure. As a, I would like to, so that I can. So this structure allows us to see the persona as a epidemiologist or a pregnant mom. I would like to achieve some goal so that I can. Okay, so this is the structure that we're going to use. So then our first slide, as a pregnant mom, I would like to know if a facility has a well-staffed surgery should I need a C-section. As a pregnant mom preparing for birth, I would like to visit a facility with an ultrasound so that I can give my baby the best care possible. Any of you who have had babies or have been close to people who have had babies, you can only imagine what it must be like if you're a man to be approaching birth and wondering how things are going. Having gone through this process myself recently, I can honestly say that I felt very assured to know that both these user stories had been supported in my area, and this is something that I think is wonderful to have, to be able to go and check on the health of your baby and be assured that you've got support around you. Next persona is the epidemiologist, and in this particular case, we basically want to know the diagnostic services so that sample analysis can be performed. Where are they? And when it comes to disease outbreak events, understanding the capacity of the facility, how many doctors and nurses are there, and as a result of that knowledge and being able to see the staff complement, one is able to assess the capacity to manage a disease outbreak event. Finally, as a citizen responding to a road accident, I want to know where the nearest emergency facility is so that I can get there quickly. Okay, so using that sentence structure, what we've done is we've been able to identify these three sections: who, what, and why. And we understand that we are dealing with an epidemiologist, a pregnant mom, and a citizen. And we understand the attributes that they're interested in: diagnostic services, or the number of doctors, having a well-staffed surgery and an ultrasound, and knowing where the nearest emergency facility is. So now, as a result of the user stories, we have an indication of which attributes are the most important in OpenStreetMap and the Healthsites baseline health facility attribute list. Okay, and so here are the tags that are beginning to take their shape. And essentially, this is what we've done in Senegal recently through the HOT micro grant with Lamine and OpenStreetMap Senegal, as well as HiGit and AfriMapper. We've been mapping emergency health attributes. Okay, so, and as a result of mapping these emergency health attributes, we are beginning to make this story come true. So this user story of, as a pregnant mom preparing for birth, I would like to visit a facility with an ultrasound so that I can give my baby the best care possible. Okay, and in Healthsites, now that we know the diagnostic radiology attribute is the one that we're interested in, we're able to go in and run campaigns with our colleagues in the health cluster to share this information. So if you are an organization working in Mali or Niger or the DRC or Zambia or Angola or places in Africa that have large rural areas which are challenged when it comes to Sustainable Development Goal 3.8. However, your organization happens to be working in that area, we would love you to share information such as this so that we can provide these services. So here's an example now done by our colleagues in AfriMapper who have presented the bed data that we collected this year. So you can see on the right-hand side is what the bed count was in health facilities throughout Senegal prior to 2020. That purple circle in St. Louis was the extent of it essentially. And then following the data collection, now we have a good definition of the bed data available. And as a result of this bed data, if you are an analyst sitting in Washington, DC, and wanting to get access up-to-date data on bed capacity, or let's say you're in a part of the world that you want to understand the regional risk of disease outbreak events, you want to see it quickly, and you don't have a relationship with the Ministry of Health, you're not sure where the link is to their data. If it's in OpenStreetMap, you can perform this analysis, and an epidemiologist can then understand how one can manage a disease outbreak event. And essentially, this is what we're looking to achieve so that we can address disease outbreak events like happened in Sierra Leone in 2015. Okay, so that's the end of the presentation. If you would like to find out more about this method, please contact me. I'd be happy to share the information with regards to the Kawakita method. And in addition to that, we're running campaigns to drive the development of the data with these user stories, and we'd love to help you define them and get the data into OpenStreetMap to support people on the ground and what their needs are. Thank you very much.
Yeah, thank you so much, Mark, for sharing with us. I think it's very amazing to hear more about Healthsites.io, a platform that we've been hearing about on social media when COVID-19 hit the most countries around the world. So thank you so much for sharing with us about Healthsites.io and even a specific use case in Senegal. So for the next session, we're going to have a presentation by Marcel from the University of Heidelberg, who will be sharing with us on OpenStreetMap for healthcare access in this room. But in case you're interested in the other presentation, here is the link. I'm just posting it right now on chat to the second room. So yeah, so if you're interested in remaining in this one,